First and foremost, I want to commend my colleague, Senator Haywood, for taking up this tour, for listening to people, for being pragmatic about access to information that could be actionable in this building. I told my own constituents in a video presentation right after Senator Haywood paid his visit to Scranton that I'm so proud of him because he is collecting information that is actionable in this building, and I hope to see legislative activism on these issues. You know, we have grown as a country to respect work, right? It's in the psyche of America to respect work and a good work ethic. And we have people who are working but who are not living in dignity. That's right. And this is the working poor is a big lesson for me back home in Senator Haywood's visit. We went to the St. Francis of Assisi Food Kitchen in Scranton and met dozens of people there, Senator Haywood and I, and some of these folks work, some of them traveled from a long ways away from Scranton just to get one nutritious meal. Seniors in my district rely on Meals on Wheels. It might be the only meal they get. Children in my district get fed at school. It might be the only meal they get. We need to respect work, ladies and gentlemen, and Senator Haywood mentioned this benefit cliff. We write the rules. I understand scarce resources, means testing, I get it. But if we're going to reward people who are working, let's not kick them to the curb when they do something right and get a job. So I just, I want to commend the senator for his work, and I really look forward to the legislation that will follow. The other thing that we did when we were in Scranton, Senator and I walked to Scranton Primary Health Care. It's a primary health care provider, federally qualified certified health care provider, and they talked to us a little bit. And this building, folks, was about 1/5 the size of the room we're standing in, stacked up on 4 or 5 floors, and you had physicians and other allied healthcare professionals providing really valuable health care out of this building to many of whom are the working poor. In fact, mostly, if not all of them, Medicaid. And I commend our governor and I commend members of the caucus that I serve who advanced this idea of expanding Medicaid to allow thousands and thousands of Pennsylvania for the first time to get access to health care, dental care, preventive care, all of that. So we have a lot of work to do, an awful lot of work to do in this space. And it was President Kennedy that said we do these things not because they're easy, because they're hard, right? This is one of those calls, to action, because we have to get it right. And so I was really proud to welcome my colleague to Northeastern Pennsylvania. I'll be glad to have him back as he rolls out the findings of his tour. And I look forward to working with all of my colleagues on both sides of the aisle to make sure that Pennsylvania is a better partner and respects the dignity of work and the working poor in Pennsylvania. Thank you very much.